Hello everyone, this is James Braithwaite of Braithwaite Physiotherapy. Today we're going to talk about nerve flossing. Now I know that this is something we've discussed in the past, but I think that it's time to revisit it and talk about some new information that's been coming out around these types of techniques and to just revisit the topic because it's such a common problem that presents into my office anyway. So when you've got a peripheral nerve compression, this is the type of injury for which you'd use a nerve flossing technique. It's very different from a nerve root compression at the spine. So there's these issues that happen right at the spine, and then there's issues that can happen further along down the nerve distribution, down the leg, say, or in the arm somewhere, depending on what region tends to be giving you problems. When you have a nerve issue that's right at the nerve root, so closer into the spine, they tend to present in very specific manners. So you'll get that numb and tingly type sensation that comes along with nerve problems, but it'll be into very specific fingers or very specific toes. So people will say, oh, it's numb and tingly into my thumb and index finger, but not into any of the other fingers, right? And that tends to be more typical of a nerve root problem that's happening right at the spine. Peripheral nerve issues tend to be a little bit more vague. Oh, I got this sort of whole hand numb and tingly. I've got general weakness rather than very specific weaknesses. You can still have other issues in common with the nerve root type problems like reflex issues, but some of the other symptoms tend to be a little bit more vague and spread out. So if that sounds like you, then nerve flossing can be an appropriate technique for you. Again, it's always good to speak with your physiotherapist or other health professional to be sure that what you're dealing with is indeed a peripheral nerve compression. But assuming that it is, that is your problem, one of the techniques that you might use is a nerve flossing technique, and this is something that we've talked about before and we're going to revisit again today. And the nerve flossing technique is a technique that allows you to put some tension and movement into that nerve along its distribution to try and tug it loose from anything that it might be sticking onto or getting stuck in between. So a couple of muscles or other soft tissue that it's compressed in between or stuck to. Nerve flossing technique can help to tug it loose. So, in the past we've talked about doing a flossing technique called a tensioner, and I think I've demonstrated in a video in the past where you're doing a lower extremity nerve tensioning technique just by doing a little kick out like this. And what I'm going to do today is offer you a little bit of a modification. We're going to go from this tensioning technique to what I call a sliding technique. Not just me, all kinds of physios in the scientific community. We call this a sliding technique. Sliding techniques ask you to slacken the whole neural line on one end and tension it on the other end, so that you have this movement pattern that looks like this rather than a tensioning technique that looks like this. So if this is my rope here, I can tension it or I can slide the rope, and what we're going to do is show you the sliding technique. So for my lower extremity, if I've got a peripheral nerve compression problem in the lower extremity, the sliding technique will ask you to slacken at your neck, right? So you're going to look up as you kick out tension at the leg. So it looks like this, right? Versus a tensioning technique, which is just this, right? Tensioning the rope, sliding the rope, right? So what I'm doing here is I'm tensioning down here as I slacken here, and then I'm relaxing here as I tighten here, right? So we're imagining this neural rope is starting at the brain and ending in the toe, and that's why we use the slackening and tensioning technique both at the neck and at the lower extremity, if that makes sense. When you're doing a nerve sliding technique, you're going to move just to but not through where those symptoms start to come on. So as I kick my leg out, at some point those symptoms, the numbness, the tingling, maybe an electric or burning discomfort will start to come on. You're going to do this sliding technique to that point, but not through that point. You're not trying to set a new Olympic record with the size of your movement or anything like that. So you're going to do a set of 10 of these sliding techniques, right? And you're going to do that twice in a day to start with. Should be comfortable, should not be an increase in pain, and over the course of time, over a few days, you should notice that the size of the movement that you're able to generate before those symptoms starts to come on increases. So this is a good generic lower extremity nerve sliding technique. Once again, slackening at the neck, tensioning at the lower extremity, tensioning at the neck, and relaxing at the lower extremity, right? Just like that. At the upper extremity, I like to use a median nerve slider. There are some movements that may be more appropriate for you. Again, this is something that you can talk to your physiotherapist about, but a good peripheral nerve sliding technique at the upper extremity looks like this. I call it the walking like an Egyptian. We've shown you this one in the past. This is tensioning the rope, but now we want to slide the rope, so I'm going to slacken on one end as I tighten on the other, and tighten on the other end as I slacken at the elbow here, right? So it looks like this. So now we're sliding that rope rather than just tensioning it, okay? Again, you're going to the point where the symptoms start to come on, not through the point where the symptoms start to come on. So if you want to learn more about this, in the blog post on this that's written up on my website and linked to in the comments of this video below, there are some further references that you can read there. So I do suggest that you check that out, and you can dig deeper should you want to. If you have any questions about these nerve sliding techniques, these sliders versus the tensioners that we might have done in the past, you can certainly feel free to reach out towards me or ask your friendly physiotherapist wherever you are as well. And hopefully this has given you some insight as to how to execute a good sliding flossing technique. Okay, so try that out. Let me know how it goes. I'm James Braithwaite of Braithwaite Physiotherapy, helping you to move beautifully.